Welcome back to the channel. The referral intake and admission process in home health care is a critical initial step that sets the stage for providing care to a new patient. This process involves receiving a patient's referral, evaluating the patient's eligibility for home health services, and initiating their admission into the Homehealthagency's care program. It involves careful evaluation, collaboration with referring sources, and the development of a patient-centered care plan. This process is essential for delivering high-quality and effective home health services. In today's video, we will look at some frequently asked referral intake questions and their answers. Let's dive in. What constitutes a valid referral? In order to be eligible for the Medicare home health benefit, a patient must be under the care of a physician. When an agency receives an initial referral or contact about a patient who needs service, the home health agency must ensure this physician or another physician will provide for the plan of care and ongoing orders. If a physician is willing to follow the patient and provides adequate information, name, address, contact info, and diagnosis and/or general home care needs regarding the patient, this is considered a valid referral. In cases where the referring physician is not going to provide orders and follow the patient, this is not a valid referral. In the example of a hospitalist who will not be providing an ongoing plan of care for the patient, the home health agency must contact an alternate or attending physician. And upon agreement from this following physician for referral and/or further orders, the home health agency will note this as the referral date. We receive a referral today. The following day, we receive a faxed update that there will be a possible delay in the patient's hospital discharge. What is the referral date? If start of care is delayed due to the patient's condition or physician request and no date was specified as the start of care date, then the date the agency received updated revised referral information for home health services to begin would be considered the date of referral. The agency receives referral after business hours. Date of referral is the date stamped by your fax machine indicating when the referral was received. Agency receives fax 2 to 3 days after the physician-ordered start of care date. The agency should contact the physician to state that the patient referral was received after the physician-ordered start of care date and to confirm that the patient is still in need of home care services. If the need still exists, a valid start of care order with updated referral or physician's ordered start of care date can be obtained. Family calls agency to admit a patient. Is this a referral? If a patient or family member makes initial contact with the agency and has not discussed and/or received home care orders from the physician for a referral for home care, then this is not considered a referral for the purposes of determining compliance with conducting the initial assessment visit. In this case, the agency should contact the physician to obtain necessary orders and then conduct the initial assessment visit within 48 hours of that referral, within 48 hours of the patient's discharge from an inpatient facility, or on the physician's ordered start of care date. Face-to-face timelines. If the face-to-face encounter does not occur within the 90 days prior to the start of care, or within 30 days after the start of care, then the Medicare home health eligibility criteria have not been met, and the episode is not covered or billable as a Medicare home health episode. Next, let's look at Surveyor Prep Q&A for intake and admission. Has a qualified clinician performed the initial assessment timely? Was the initial assessment visit done within 48 hours of referral or return home or on the physician or allowed practitioner ordered start of care date? Do you have a face-to-face encounter that supports homebound status and skilled need? Is there a face-to-face documentation 90 days prior to start of care or 30 days after that relates to the primary reason for home health? Did the agency accept this patient under a consistent acceptance to service policy? How did you determine capacity, competency, caseload before accepting the patient? Is your acceptance to service policy applied consistently and publicly describe services and/or limitations? If you decline a referral, do you document why under the policy? Is there a consistent, non-discriminatory reason recorded per your acceptance to service policy? The agency should be able to show declination, log, plus policy criteria checklist. Is the patient homebound and is care medically necessary? Where is homebound status documented? What facts show normal inability to leave home and considerable and taxing effort? The agency should be able to show assessment narrative tying conditions, functional limits, assistive devices or assist, and physician support and certification. Was the start of care scheduled and communicated promptly? Do your records show prompt start of care from referral or discharge and internal communication to team, DME, and vendors? The agency should be able to show intake log, start of care schedule, team notifications, and DME orders. Is there a complete individualized plan of care and is it kept up to date? Does the plan of care reflect the updated comprehensive assessment, measurable goals, disciplines, frequency, duration? Are revisions communicated? The agency should be able to show current plan of care with measurable outcomes, revision history, and communications to all disciplines. Was the plan of care certification obtained correctly and on time? Are recertifications timely? Is recertification signed and dated by the physician or allowed practitioner? Is recert at least every 60 days and coordinated with plan of care review? The agency should be able to show signed certification aligned with plan of care establishment, recert signatures each 60 days, no billing before certification. If you used verbal orders, did you follow countersignature rules? Are verbal orders promptly written, dated by the receiving clinician, and countersigned by the physician or allowed practitioner before billing? The agency should be able to show verbal order log entries, countersigned orders in record prior to claim submission. Is the comprehensive assessment, including OASIS, complete and on schedule? Is the OASIS-based comprehensive assessment done per regulation on start of care, resumption of care, recert, significant change, etc.? Are validation reports retained? The agency should be able to show OASIS events in EMR validation reports and assessment updates. Do intake files contain complete referral documentation? Are demographics, diagnoses, med list, allergies, discharge summary, face-to-face orders, payer eligibility, and caregiver home safety captured before admission or promptly at start of care? The agency should be able to show intake packet and checklist, QA, pre-admit review notes. Are patient rights consent, HIPAA, obtained at or before admission? Where are signed consent to treat patient rights and privacy notices? The agency should be able to show executed forms with dates and patient acknowledgement. How do you coordinate services across disciplines and external partners? How are referral details, orders, and plan of care communicated to nursing, therapy, home health aides, social workers, external DME, or pharmacy? The agency should be able to show case conference notes, EMR broadcasts, secure messages, and vendor orders. Are you monitoring process quality, QAPI, for intake and admission? What metrics do you use to track time from referral to start of care, percent complete packets, late certifications? What actions did the agency take to correct errors? The agency should be able to show QAPI dashboards, audit tools, and PIBs. Thanks so much for watching. If you found this video helpful, give it a thumbs up. It really helps others find it too. Don't forget to subscribe so you don't miss out on more tips and resources. Looking for easy-to-use digital tools for managing home health? Check out my Etsy shop, link is in the description. If you have questions, ideas, or want to share your experience, leave a comment. I'd love to hear from you. And feel free to share this with anyone who might find it useful. See you in the next video.